70 km du chef-lieu du Kwango. Et la route n'est pas assez facile. Les équipes prennent 2 jours partant du chef-lieu de Kwango pour arriver à Panzi. Donc, c'est une zone d'accès très difficile et il n'y a pas de réseau de communication. Donc, c'est une zone, quand vous êtes là, même les équipes qui sont là, on a des fois du mal à communiquer avec elles parce que ce n'est pas une zone qui est vraiment couverte. Et c'est ça aussi même la difficulté que nous avons pour l'acheminement même des échantillons sur Kinshasa. Et voilà un peu l'environnement et la situation par rapport à la zone santé de Panzi. Voilà, à vous.
Thank you. Thank you so much. When the director is talking, for those who want to understand what was my starting in the public health area, I was medical doctor and leading the medical district neighbor to Panzi. We didn't have network, we didn't have roads. It's exactly the same after almost 25 years. It means colleagues who are there, we need to support them because they are working in a very difficult environment. And we hope we can know what is going on and have with the government a clear plan to support this region. Over to you, Margaret.
Thank you, DG. Let's take the next one from the chat box. This one is about Mpox. So the question is, how is the government managing efforts to curb the spread of Mpox in affected member states, and how effective have these measures been so far? That's the first question. The second one is, are there plans to scale up vaccination or other preventive strategies for Mpox across Africa? This is from Edward Samuel of the Voice of Nigeria. DG, over to you.
Yes, I think it's almost the same question, but let me say we have meetings every week with all countries at IMST level. They are talking with all PHIs and key people in the Ministry of Health of affected countries and at-risk countries. We are sharing information openly, transparently with everyone, and we are building capacities. We are providing support for surveillance, for laboratory. And if you see previous slides, I was showing how mostly all countries have issues in DRC, in Congo, Brazil. But DRC, it's due to the huge increase of cases and our investment didn't follow. Member states and partners, how we can achieve that. And by doing so, we are also helping with the vaccination transmission of the disease. As you saw in my presentation, we are doing a kind of screening and supporting at point of entry. We have a number of actions we are conducting that can help to stop the spreading of Mpox. To be clear, for us today, we need first to have a strong surveillance mechanism in all African countries, network, decentralized in all African countries. Third, we need to have capacitated human resources. And fourth, we need to have all tools, it means vaccines and medicines. If we have all of that, it will become a major challenge for us.
Thank you. Let's take the next question. Janice from Bloomberg, you have the floor.
Oh, thank you so much for coming back to me. You can hear me this time.
Yes, we can hear you.
Great. Thank you. My question was really around the sample quality. Understandably, the first lot were tricky, but equally from last week, I'd understood that to really get good samples, you also need to get to the point of testing them within 2 days. And from what I'm hearing again today, you know, that the difficulties of terrain, even if they've flown for the last leg of the trip, it's pushing them probably beyond that 2-day period. So I was just wondering on what hopes you have for really decent quality of these samples, considering that time delay. And my second question is probably quite left field, but I was really just wondering if there's any chance that this particular population, being fairly remote, has not previously been exposed to COVID-19. I saw from the WHO that was one of the list of things that they were considering, and I just wondered if that was something that they might possibly not have been exposed to previously.
Thank you, Janice. There will be so many people saying so many things. But as we say, Pansy is the mirror of the health system in DRC, mostly in the rural area. Today, the president, the discussion I had with the president and the minister, they are clearly telling me that they have a program, they call it 145 district, that will help to rebuild the health system at rural level. And I proposed the support from Africa CDC to see how we can implement quickly this program. We cannot achieve what we want to achieve if we don't decentralize the lab system. You can imagine Panzi, that is a region where you have more than 200,000 people without lab capacity. If they have to send samples, as the Director General was saying, using either Kikwit or Kenge. Kenge is the capital of this region. One day from Kenge to Kinshasa. What will be the quality of this sample if we don't take appropriate action? For us, we are working with the government to put the capacity to all health districts, including Panzi, to all. Now, the qPCR will not be done in Kinshasa, but it will be done in Kenge, the capital. But for this specific disease, we need even to do the genomic sequencing and everything. This is why we are bringing the sample to Kinshasa, because we don't want to miss anything. Regarding the exposition to COVID or not, you know, as I said, we are not here to spread rumors. We are the result of the sample. For all journalists, the message from DSC and from Africa CDC is clear. There is no confirmation of the pathogen. We are waiting for next week, then we'll communicate. If it will be malaria or another disease, we'll make it. Then from there, we'll take appropriate action. Directeur général, je ne sais pas si vous voulez compléter à la question de Janice.
Non, merci, DG, mais je pense que vous avez bien résumé. En fait, jusque maintenant, nous attendons vraiment la confirmation laboratoire pour savoir vraiment de quoi il s'agit. Donc, le diagnostic est vraiment attendu. Donc, c'est pourquoi il ne faut pas, comme vous l'avez dit, prêter non aux rumeurs et laisser distiller des rumeurs. Donc, au niveau du ministère, nous sommes vraiment, c'est pourquoi nous mettons tout l'effort pour acheminer les échantillons malgré les conditions difficiles au niveau de laboratoire de l'INRB pour arriver à poser le diagnostic et de là avoir une conduite appropriée pour organiser la riposte et arriver à renforcer le système de santé, comme vous l'avez dit. Donc, parce que cette zone de santé est vraiment une image de la situation de nos zones de santé, surtout en milieu rural et reculé. Voilà.
Back to you, Margaret.
Thank you. Let's take the next question. This is about Mpox. Can early antiviral treatment improve Mpox outcomes in immunocompromised? First question. The second one is, what is the efficacy and safety profile of existing Mpox vaccines in African populations with high HIV prevalence?
Shall I continue
DG?
till the end? Saibo
Yes.
Namin, if you can hear us. DJ, I think let's take
These
those
two questions were from Nermin.
To Namin. No, they're from the
Okay,
chat box.
I lost you a few minutes. I think I got the second question about the safety, but can you please repeat, because
Yes,
Nermin was talking.
So can early antiviral treatment improve Mpox outcomes in immunocompromised patients, particularly those with HIV and AIDS? That was the first one. The second one is about the efficacy and safety profile of existing Mpox vaccines in African populations with high HIV prevalence.
Thank you. This is a subject of research that Professor Musoka is conducting. Chanel, are you with answers to these two questions? Over to you, IMST.
Thank you very much, DG. In terms of treatment for antiviral, as you know, the only available therapeutic trial we had was the variant treatment. So we have no antiviral now in terms of the therapeutic. We're working on the Brazilian COVID trial that we are going to begin recruitment in December, and HIV will be some of the population we target. Most of the vaccines that have been used have included HIV as national NM. They are targeted as special people of population of interest, including high-risk sexual workers, and they have national NS safety or efficacy issue. We reviewed some data, especially in Rwanda, where they didn't see any unusual adverse effects. But in terms of antiviral treatment, none exists now. We'll be able to know answers in about 2 or 3 months when we launch the Brazilian COVID trial in December. Thank you.
Over to you, Margaret. Thank you, Professor Musoka.
Namin, if you can hear us, you can come in. Namin, can you hear us?
I can hear you. Can you hear me?
Yes, we can hear you. Go ahead.
Thank you very much. My questions was already answered. Thank you.
Thank you.
All right, thank you. Let's move on to Ida from South Africa. You have the floor.
Thank you very much, Dr. Kasia and Margaret. Can you hear me?
Yes,
we can hear you.
Thank you.
Wonderful. Could you please talk a little bit about the term disease X, which was, as you I think hinted earlier, was so quickly used in the media, and I don't know where this originated. But I mean, given that the nomenclature or the term disease X in our minds has been reserved for an yet undefined pathogen, a new pathogen, and given that we do not yet know what this pathogen is, what illness those people have, is it not perhaps unfortunate that the term disease X is now being so widely used? And what are your views on that? Thank you.
DG.
Thank you. DG, à vous.
Oui, merci pour la question. Bon, on demande pourquoi on parle de la maladie. Effectivement, on n'a pas encore la cause, le diagnostic pour cette maladie, c'est pourquoi on peut l'appeler, nous appelons la maladie d'origine inconnue, d'étiologie inconnue jusque-là. Mais les signes que la plupart des malades présentent, parce que l'équipe d'investigation et voir quels sont les signes que présente la majorité des malades, c'est que le tableau clinique, c'est la fièvre principalement, les céphalées, accompagnées de rhinorrhée et de toux. Et deux fois, on a des difficultés respiratoires qui apparaissent. Donc voilà les principaux par les patients. Mais je l'avais dit aussi la dernière fois, c'est que cette zone de santé, c'est sur un terrain vraiment d'une forte malnutrition. Donc, c'est un terrain où il y a la population, c'est une forte malnutrition qui est notée, surtout chez les enfants de moins de 5 ans, et c'est surtout parmi les patients, plus ou moins plus de 40% de ces patients sont des enfants de moins de 5 ans. Les signes, les principaux symptômes qui sont représentés par les patients atteints de cette affection. Merci.
Merci. Juste pour... merci, DG. Ida, just to be clear, DRC, they are not using disease X as etiology. I think even ourselves to be aligned with DRC Africa, since we will no longer use disease X, we'll start to use febrile illness of unknown etiology till when we'll get the confirmation. Thank
Wonderful.
you.
Thank you so much for that. Thank you.
Back to you, Margaret.
Thank you, DG. The next question is on Mpox. So since the launch of the Mpox vaccination in DRC, how has the epidemiological curve evolved in relation to new cases?
DG, à vous, puisque vous dirigez aussi Mpox en RDC.
OK. Par rapport à Mpox, parce que la question est en rapport avec la courbe épidémique, au cours des 3 dernières semaines, nous constatons une légère tendance à la baisse au niveau de notre courbe épidémique. Et pour donner un exemple, bien qu'un nombre absolu de cas, si je peux, nous sommes autour de 60 cas notifiés, mais quand on regarde par semaine le nombre de cas, la semaine 48, nous étions à 487 cas qui étaient notifiés. À la semaine 49, nous avons eu 604 cas, donc une légère augmentation. Mais quand on regarde de façon globale, la courbe, nous avons une légère à la baisse. Mais il y a des provinces quand même où les nombres de cas continuent à augmenter. Dans certaines provinces comme au sud Kivu, nous notons toujours que dans cette province-là, et nord Kivu, la tendance demeure quand même toujours à la hausse. Voilà.
Merci, DG. We have Dr. Doud, who's working on a vaccination pillar. And the question was, how can we assess the impact of the vaccination in the region where we already vaccinated vis-a-vis new cases of Mpox? Dr. Doud, can you please provide additional information to complement what the vaccination already started?
Thank you, DG, so much for the floor. The vaccination is ongoing in Kinshasa. It's been going on for a few weeks now. There's a big focus on the biggest area is Pakajuma, where we were there last week with you, and we can report that the vaccination will commence daily now. It was initially only for 2 days, but now we'll have teams vaccinate every day in the field, which we should see we should have an increase in terms of the numbers of kids vaccinated, individuals, opposed to only going twice a week. So that should be a major impact, and then we'll expand to additional health zones in the next coming weeks. That's the planning from our side. Thank you.
Thank you so much. Back to you, Margaret.
Thank you, DG. And with that, we have come to the end of the weekly briefing this week. I will now hand it over to you for your closing remarks.
Thank you so much. The first one about we know that every week there is an increase of cases. As I was sharing with you, we saw this increase last week, and we are waiting for the samples to reach Kinshasa. As the DG said, we hope with all effort from the government and partners, we can have the samples by Monday and communicate with you. If there is a delay, the DG will be with us on Thursday. He will be the person officially giving the information to the media about the disease. I want also to say that Mpox is still a major issue. Now we are facing challenges in terms of resources. We are calling our partners who pledged funding to understand that it's time for them to disburse. We need to support more and more countries. Now we see the case in Angola, and it will continue like that if we don't have resources. This is why, if journalists can help us to make this message loud, vocal, we are calling all of them to provide appropriate support. Mpox for me is the entry point to strengthen the surveillance and the lab. If we did great job for Mpox, if we did great job for COVID, today will not face the same challenge for this disease in Panzi. I think we are learning from all of that, and we hope we'll continue to improve. With that, I thank all of you. Let us meet next week with some good news, like from Rwanda, and also with a major update from DRC. And we hope to provide additional update regarding vaccine, the Japanese vaccine, the rollout of this vaccine, and also the vaccination in other countries. Thank you so much, and see you next week.
Merci.
Recording stopped.